How can we get control and bring down the high cost of health care? That question was posed to industry experts and others in Austin today by the State Health and Human Services Committee. Fox 4's Shaun Rabb in now with more on that hearing. Shaun.
Yeah, and all the experts agree it's going to be a big operation to get health care costs under control, and even more challenging to get more people coverage. Committee members seemed frustrated at what's happened with the cost of seeing a doctor, getting a prescription, or having a procedure done in our state. Look, just under half of all Americans say it's difficult to afford health care, and in Texas, a growing number admit to putting off treatment or doctor visits because they simply can't afford it. Many are now calling for greater transparency in medical fees, especially if you have to spend any time in a hospital, where there are oftentimes mystery fees called facility fees.
Calling it health care is really a misnomer. There should be, it's profiting off of people's ailments is what it amounts to, because they have a system that is more interested in the money to be made than the health care to be delivered.
This approach is the simplest and the easiest to administer. It's just fund health savings accounts and then let people buy what they want.
Okay, that was where I was going next. Move into creating health savings accounts that employees help create, as opposed to paying for medical coverage.
Well, a number of different ideas floated during that hearing, none completely new and at times stirring emotions. Here's what I mean. Senator Molly Cook from Houston, an ER nurse, questioned that UT Austin professor over this retail health care idea, pay what you need or what you want, and how that happens when you are poor.
But what about dialysis, cancer care, care for adult disabled children, neurodegenerative disorders, pulmonary hypertension? I'm having a lot of trouble envisioning retail care for most of my constituents and the patients that I serve.
You shouldn't create a healthcare system with a safety net that's designed to help people at the price of ruining the system for everybody else. You need to be smart about how you're going to develop a safety net that allows everybody else to get health care through efficient means, while at the same time helping the people who actually need some help.
Well, that exchange brought a quick admonishment from the chair to Cook, as she again stated how hard it was to get anyone to agree to come and share ideas about how to slow, stop, or even reverse rising health care costs. So this is just the beginning of what will be in both the House and the Senate, a long series of health care hearings, trying to find the right legislative treatment to lower health care costs while increasing access and improving the quality of that care.